I'm Emily Bendel. I'm one of the residents at the Mayo Clinic, Rochester. I'm here today to talk to you about our research in angiographic appearance and treatment of arterial injuries secondary to partial nephrectomy. We have nothing to disclose. So, partial nephrectomy is frequently used to treat patients with renal cell carcinoma at our institution, and I think nationally it's generally between 1 centimeter and 4 centimeters in size, and depending on their surgical comorbidities. Postoperative hemorrhage is reported up to 6% in these patients, and angiographic evaluation and management of postoperative hemorrhage is frequently used as a minimally invasive solution. At Mayo Clinic from 2007 until 2013, we did about 1,138 partial nephrectomies, and of those, 30 patients got referred to us for post-operative hemorrhage. This is just a little brush up on the arterial anatomy of the kidney, main renal artery, posterior and anterior segmental arteries, arcuate arteries, interlobular arteries, and interlobar arteries. So the intent of our project was just to describe the spectrum of angiographic findings and demonstrate interventional treatment possibilities in this select group of 30 patients. So we had IRB approval. We queried our interventional radiology database, HiIQ, for the patients with an intent to treat from 2007 to 2013. And all angiographic evaluation and treatment was at the discretion of the individual operator. Our spectrum of ages was 23 to 83. We had almost all men, 27 to 3 females. The pathologic outcome was 22 clear cell carcinoma, 4 oncocytoma, 2 papillary carcinoma, 1 benign cyst, and 1 normal kidney, which was really after resection of a retroperitoneal tumor. They just wanted to see if those margins were clear. So 28 of our 30 patients were symptomatic. 2 of them were asymptomatic and discovered on routine follow-up imaging, which ended up being about 120 days after their initial procedure. Of the symptomatic patients, the most common symptoms presenting were gross hematuria. If you combine microscopic hematuria with that, it brought it up to about 70%. Hematoma or clot on CT that they usually obtained for flank pain or anemia, and then was 50%, and then flank pain was 43% at its lowest because it wasn't always documented. Angiographically, the most common finding was a solitary pseudoaneurysm. The second most